Today, the FDA announced naloxone, or Narcan, can be sold without a prescription. It's the first opioid overdose medication to be sold over the counter. WCI3's Chance Sticklin is with us now. Chance, you spoke with experts who say this could really benefit people who need it.
I spoke with a Central Illinois pharmacist and a public health official who say this is just one more step to get those struggling on the path to recovery.
Is going to give those people more of a chance to survive.
Joe Trotter, Harm Reduction Program Coordinator at Champaign-Urbana Public Health, says this decision is part of an ongoing process to fight the opioid crisis. He's hoping the move reaches more people.
More rural areas where maybe they don't have a health department nearby or a program nearby that can assist with, getting Narcan to them. They might not have a hospital nearby.
One of those facilities is Hudson Drug Shop. Pharmacist Andy Hudson says it's a good move.
We can provide the education to people that come into the pharmacy to get it and help them understand how to use it, when to use it, and things like that. So I think we're in a good position for that.
Hudson says Narcan isn't harmful.
It's what we call safe and effective for over-the-counter use.
Trotter says it's available at CUPHD. The state buys it and public health helps administer it.
We're able to supply it at no cost to anyone for any reason.
The Food and Drug Administration announced Narcan will be made available over the counter by late summer.
It blocks the negative effects of the opioids, and so if someone were to overdose on that, it would typically pretty quickly bring them out of that.
We need members of the public to be ready, willing, and able in case that emergency happens nearby them.
Currently, it costs Hudson's Pharmacy about $50 a dose, but he hopes once the new changes go into effect, it will be more cost-effective for consumers.
When we have 100,000 people a year die from opioid overdoses, and we can cut down that number even by a small percentage, it's certainly worth having it over the counter.
Trotter says people using these drugs still have family, friends, jobs, and are contributing members to our society and should never be forgotten.
Anything that we can do to make it easier to save them, to keep them alive, and to show them care, it's going to be hard. It is going to be really hard for us.
Right now, the price is unclear as whether insurers will continue to cover it as a prescription drug if it becomes available over the counter. Back to you.
Chance, thank you. The latest available data from the CDC shows 66% of overdose deaths in 2021 were from synthetic opioids like fentanyl. In Illinois, more than 3,000 people died of overdoses in 2021.